Hi, I'm Dr. Kenneth Sharlin, and pleasure to spend a few minutes with you today. I want to talk with you about something very important to the clinical practice at Sharlin Health and Neurology. We're really a pioneering neurology clinic that focuses on a combination of cutting edge traditional neurological approaches, emerging neurological concepts when it comes to patient care, and functional and regenerative medicine, and bringing all of those pieces together to really help our patients. One of my mentors would say that traditional medicine is about the pill for an ill. And there's a lot of truth to that statement. Sometimes it's absolutely necessary to take that approach. But we shouldn't end with that approach. As Harry S. Truman would say, the buck doesn't stop there. Well, it's a variation of Harry S. Truman, I suppose. So, what am I actually talking about? I'd like to share with you the first of several videos in which I talk about what is called our 5-pillar system. This is the approach to patient care at Sharlin Health and Neurology. So if you were to come and see me as a patient, you would be guaranteed that we would be using this approach with you. And that's particularly if you're going to engage myself and my team in a functional medicine approach. Now, the first of these 5 pillars is called identify. And in general, that should be the part of medicine and neurology that you as a patient, if you're familiar with the experience of going to doctors, should generally be most familiar with. Identify is about clearly understanding what is the problem, giving it a name, finding a diagnosis. Too often patients come to see me and they have a spectrum of symptoms from brain fog to numbness to weakness to dizziness, and they don't understand what is going on with them. For those of you who are familiar with functional medicine approaches, you might hear things like mold toxins and Lyme disease, heavy metals, nutrient imbalances, food sensitivities, and so on and so forth. And there is some truth to that, of course. We'll talk about that later. But those are more about root cause imbalances, and we first have to understand the big picture of what is going on. Those are what influences that downstream disease. My friend Dale Bredesen talks about 36 holes in the roof when he describes the various causes of Alzheimer's disease, meaning that there isn't simply one cause. There are many causes. And in fact, the causes for one person is probably different than the causes for another person. And that's absolutely true, whether it comes to Alzheimer's disease, multiple sclerosis, amyotrophic lateral sclerosis, migraines, and so on and so forth. All the things that we help people out with when it comes to neurology at Sharlin Health. So identifying the problem correctly, how does that work? First, it begins with a proper medical history. We absolutely cannot skip the history. I'm going to sit down with you and say, tell me about what brings you here and what are some of the things you're dealing with? What are your symptoms? You'll go through them one by one. When did it start? How did it progress? Did something trigger all of that, or did it start out of the blue? Has it gotten worse over time? Are there things that make it better? Are there things that make it worse? Have you had any testing up to this point, like an MRI or blood tests, for example? So this is a pretty traditional medical history, but it is so important not to skip this part because it turns out that about 80% of the diagnosis when it comes to our own health or illness is in the medical history. Maybe one of the big differences at Sharlin Health and Neurology is that these are not 5-minute encounters. Nothing gets solved in 5 minutes. There's that old expression that Rome wasn't built in a day, and that's absolutely true when it comes to diagnosing complex neurological conditions. So we have to put on our best listening ears and take a proper history, listening to the patient. Then, in addition to reviewing any past medical history, family history, social history, and so forth, allergies, any medications you're taking, we go through a neurological exam. Again, this is absolutely not to be skipped. The neurological exam is critical and is composed of several key parts. That includes what we call the mental status examination. So are you awake? Are you alert? Is your speech slurred or clear? Do you know your words? Can you come up with the right words? Are you oriented to time, place, and situation? That's the mental status examination. We then go on to examine the cranial nerves. And if this is everything from the size of your pupils to how you move your face, and we might say, raise your brows or show me your teeth, for example. That's the seventh cranial nerve, by the way, the facial nerve. There are 12 cranial nerves altogether, and some of you may have heard of the vagus nerve. That's the 10th cranial nerve. It's the longest nerve in the body, and it gets its name, I believe, from the Greek, but it translates roughly to mean the wanderer, and the vagus nerve is very important in functional medicine. So we go through an examination of all the cranial nerves. We then move on to an examination of what is called the motor system. And this does include strength in all four limbs, but it also includes muscle bulk. So in some cases, people lose muscle mass. We see that, for example, in Lou Gehrig's disease or ALS, but other peripheral neuropathies as well. We want to feel muscle tone. Is tone normal when I passively move your limb? Is it rigid like someone with Parkinson's disease? Is it spastic, perhaps like someone who's had a stroke? Again, then we go through all the muscle groups and grade strength on a scale from 0, meaning you can't move at all, to 5, meaning full strength. Next is a test of coordination. And some people, they chuckle a little bit during this part of the exam because, they've seen policemen with their people they pulled over on the side of the road having the, walking heel to toe, like on a tightrope, and maybe touching my finger and then touching your nose, for example. That really is a neurological exam. That's not just a police interrogation, of course. That's a neurological exam, and that's a test of coordination. We also want to look at things like rapid alternating movements that go like this, and we ask you to take your heel and ride it down the shin bone. So, coordination involves your upper extremities and your lower extremities, and it's also evaluated when I watch you walk. Now, in some cases, there may be some additional aspects to that exam, either introduce the motor exam or coordination exam portion. For example, looking at fine motor control or fast motor movements. That's often affected in people who have Parkinson's disease, so we may ask them to tap their fingers or pat their hands real quick, of course. Now, the next step is the examination of reflexes, deep tendon reflexes. And when I pull out my reflex hammer, a lot of people sort of position themselves so that I can tap on their knees. And that is an important area to test deep tendon reflexes, but I'll be looking at that in your arms and in your legs. And this tells me not only about the integrity of the nerves that control your muscles, but also the integrity of the nerves coming down from your brain through your spinal cord that will send the signal to the nerves that control your muscles. That's called the corticospinal tract. We do an examination of sensation, and at the very least, we're going to test temperature and vibration, sometimes the ability to discriminate a fine point from a dull point, or I may hold the end of the finger or the toe in my hand and say, don't look, or look, close your eyes, and bend that digit up or down to see if you can tell if your finger or toe is going up or down. That's called a test of proprioception. And that's very important. That translates into things like if you were to stand at attention and close your eyes, normally you shouldn't fall over. But if you have proprioceptive or position sense difficulty, you might lose your balance. And by the way, doing that test, meaning stand up straight and close your eyes, is also part of the neurological exam that's called a Romberg test. So lastly, we are going to test gait. I'm going to have you stand up, walk across the room, walk heel to toe, and turn and so forth. I'm very interested in, are you able to get up from a seated position? What does your stride look like? Is it shuffling? Is there what's called steppage gait, where you're lifting your knee really high and, flexing at the hip? And that's usually because there's something called foot drop. Now, importantly, all this is put together into something called localization, which tells us where within the nervous system is this problem coming from. Because it's very important to understand that, say, for example, weakness is not exclusively a muscle problem. You might be weak because your muscles and nerves are not communicating. You might be weak because the peripheral nerves are affected. You might be weak because of a spinal cord problem or a brain problem, and so forth. So before we even talk about what is the cause of the problem, we need to talk about where is the problem coming from. And that's actually called localization to a neurologist. Very, very, very important. Without localization, we can't really talk about cause. Now, I'm going to take a little bit of a jab at some of the functional medicine testing that I've seen. I do use functional medicine testing, but not all of it. And people say, well, why don't you do that test or this test or that test and so forth? And I'm not going to name specific tests, but the point is I've seen tests that make absolutely no sense to a neurologist because they really fail to take this localization step. They test for different antibodies from all different, parts of the nervous system that have nothing to do with one another. And like I said, if you want to run into problems, you can do random tests. This localization is absolutely critical, and that is understanding where within the nervous system the problem is coming from, and that is deduced from the history and the physical examination findings. So once we have the localization, we can then think about the various causes. We do tests that are not appropriate. We don't spend the time listening. We don't, really think through the problem. And that, of course, leads to incorrect diagnoses and even potentially someone getting hurt. So we always have to start with identify. That is the first pillar at Sharlin Health and Neurology. I look forward to sharing with you the next pillar. You might find that really exciting because that's when we investigate all the contributing factors to why you got sick in the first place. That gets into the functional medicine piece, and that'll be on my next video. So stay tuned. If you're interested in this, watch more videos, check out our website, check out our Facebook page, like us, follow us on Twitter and Instagram. It's been my pleasure chatting with you. I'm Dr. Ken Sharlin. I look forward to visiting with you again soon.